let's start with our numbers. First of all, right now in Ohio, we have 28,454 cases, an increase in the last 24 hours of 531. And we have at this point 1,657 Ohioans that we've lost to COVID. That was 32 more reported in the last 24 hours. And I want to say, in hearing, losing our colleague at DRC, we know that every person is not a number, and we know there are just stories beyond stories behind these numbers. So I just want to say to the families, we don't take this lightly. And Stacy, her story is very important because I think it shows us that there's a lot more to this disease, and the morbidity is the term we use, not the mortality, Governor. And morbidity is how sick people can get and the impact of that. So it makes us take pause and makes us remember how very careful we do have to be. Moving on here, Eric. Really, we've tested now 270,000 in Ohio. We're seeing about the same levels. If we go to the next slide, we do, I overheard Andy Chow giving an analysis. We really are not seeing a lot different. This is a plateau, and in that plateau are a number of people who are still being sick and being hospitalized. Next slide. Our testing is increasing. We reached at one point one day over 10,000. Our 7-day average was in the high 9,000s. But more importantly, we have an incredible team of people. I spent a good deal of time this weekend, which is an outstanding group, working on an entirely new way of logistics. You heard the director talk a little bit more about how can we use our testing very wisely but deploy it very quickly. We're working alongside the National Guard, all our hospitals, our health departments, and particularly focusing on these congregate settings where we know there's such high risk. So again, I think we have a system we're building here in Ohio that I really think will move us forward, not just in the numbers we test, but in how we test effectively. And Governor, just want you to know your team is working really around the clock, and that is quite literal, waking up at 6 a.m. and to the next Zoom meeting all weekend long. So we'll have more to share about that. Next slide. I just want to take a moment each day. I thought I'd talk a little bit more, and there have been articles written about how we really measure our progress as we move forward. Again, we're learning a lot as we go that will not change, I think, and you can see every state is struggling with this, every country is struggling with this. So each day, again, I think I'll review a number that we're following here in Ohio, and one of them is the R-naught, a little bit of a statistical calculation. This isn't a modeling, this is a mathematical formula that really talks about the spread of infectious disease, and it's really based on how susceptible the population is to a disease, how infectious it is, but more importantly, the third factor, what we do to stop the spread of that disease. And a lot is said about, remember early on, we talked a lot about flu and trying to, decide was coronavirus going to be a lot like influenza. Influenza has an R-naught, which is the spread of disease, of around 1.2. So for every person who catches it, they have the ability to spread it to 1.2 people. And I can tell you that even at that level of a spread, in the winter, during high peak flu season, our hospitals can be at 95% capacity just from flu alone. So that is sort of a measure that we can look to. What we really want is it to be less than 1, because that's when a virus starts to peter out, when I can't give it to another person or less than another person. And we know with COVID, we've seen anywhere at its peak from 2.5 to even in some studies as high as 5, so 1 to 5 spread. But right now in Ohio, fortunately, we're seeing us at about 1 to 1, and that's due to all the changes we've made. And this slide just shows that if you're at a 1-to-1 spread, you really can't get that logarithmic spread. We see that more in congregate settings when people are very close together. But when we can keep the social distance, when we can wear the mask as a barrier, we really help keep this disease from spreading. We keep people from getting sick, and we keep from overwhelming the healthcare system. But if we don't do those actions, one person can become 4 people, can become 16 people, and that goes on and on logarithmically. And that's, that will give us our next peak and our next surge. And so while we all, and I think the governor talked about, and not surprisingly, and we've seen this in history before, when you first open up a bit, people surge out back to life. But I really caution people to move carefully, because we really, the actions we're taking very quickly with this very infectious and very deadly disease can spread quickly. And Arnott, next slide, makes a little graph that looks something like this wave here you see. And we've done it for Ohio. The dotted line is a 1-to-1 person spread. We came originally up from about 2 to 2.3 in Ohio and dropped down. We actually follow our zones. You've heard us talk about, we've divided Ohio into 3 zones, so we're following this number closely, and we can even follow it at a local. But we're down there numbers now, and we don't want to see that pick up as we start to move about. And if we see a number like flu, like a 1.2 or starting to go up, we'll pay attention to that and follow that in the days to come. So again, are not one of the many things besides cases, besides deaths, besides hospitalizations, and I'll teach you more of the numbers we're following in the days to come. Next slide. I do want to share this very nice slide. It was shared with me first by Dr. Rick Lofgren. He's actually the lead in Zone 3, which includes the Cincinnati areas and surrounding areas and the Dayton areas, and he is CEO of UC. And this graph was actually made by Mike Venerable at Cincinnati Tech, Cincy Tech, and he was trying to find a picture way to explain how important masks are. He's looking at the evidence, and he's just really showing that, remember, masks really help with the spread of the respiratory droplets, and it can decrease the viral load up to 86% of those droplets. That's astounding in many, many ways. But remember, keep the distance as well. It's Swiss cheese. None of these things stops it. Wearing this mask does not protect you 100%. Keeping far apart and wearing the mask in crowded situations and doing other things like washing your hands, all of that together gets you closer to that 100% and stops us from transferring this disease. So this is fascinating research. Thank you so much to Cincy Tech, and we'll have this graph on our website.